So in-office or office-based procedures specifically to ENT and specifically to the nose are procedures that were traditionally done in the comfort of an operating room or an operating theatre. Nowadays, with the right tools, with the right technology and the correct expertise, a lot of these procedures can be done in the comfort of a outpatient clinic room or in a procedure room. It is done very safely. It's done under local anesthesia without the need for any general anesthetic. And in some instances, we do use sedation. The main benefit of doing in-office procedures or having your procedure done as an in-office procedure is that you no longer require general anesthesia. What this means for you is that it's much easier. You no longer have to worry about fasting or starving for 6 hours prior to a general anesthetic. You don't have to worry about coming into hospital early on in the day, having the pre-op checks, having the procedure, and then staying for several hours after an operation to then go home. In an in-office procedure, you simply come in, you have local anesthetic, the procedure gets done whilst you're awake, and then you go home maybe 30 minutes later. So it's much more convenient for both the doctor as well as for you as the patient. With this in mind, it is also cheaper in cost for yourself because there's less hospital equipment used and less hospital requirements. You can return to work the same day or at the very latest the next day, so you require less time off work. And finally, whilst I'm doing the procedure, you can guide me and you can give me real-time live feedback into how much it's improving your symptoms and if I need to do anything further. So for example, if we're doing a balloon dilatation of your eustachian tube, you can tell me, oh yeah, that really worked, or that needs a little more doing, or that didn't work. I have a very large practice of in-office procedures, and the most common procedure that I perform under local anesthesia in the office environment, I would say, is a nasal valve implant. And I'll talk to you more about this later on. The second most common procedure that I perform under local anesthesia is a balloon dilation of the eustachian tube. The eustachian tube is a tube between the nose and the ears, and it helps you to equalize pressure. The other procedures that I do very commonly in office and under local anesthesia are reduction of the turbinates, which is a part of your nose that can get swollen and block your breathing, posterior nasal nerve cryotherapy, which is used for runny nose, and finally, balloon sinuplasty, which is used for recurrent sinus infections. You can absolutely treat the symptoms of allergic rhinitis using in-office procedures. Actually, this is probably one of the best indications for in-office procedures. So taking a step back, the main symptoms of allergic rhinitis include a blocked nose, a runny nose, sneezing, eye itching and eye watering, and finally, symptoms of eustachian tube dysfunction, which include popping of the ears, blocked ears, congestion of the ears, and the inability to equalize your ear pressure. Now, first, before you have any procedure, you must have maximal medical treatment. And by this, what I mean is you have to have a good tablet antihistamine that you take on a daily basis, and you also have to have a good nasal spray, which is typically a combination of a steroid and an antihistamine that you also use on a daily basis. Now, if your symptoms persist despite using this, what we call maximal medical therapy, then perhaps a procedure is for you. I like to divide patients into a few groups. The first group is when your symptoms are predominantly a blocked nose or nasal congestion. And in the context of allergic rhinitis, this is often due to swollen turbinates or swollen lining of your nose. And we can do a very, very good in-office procedure where we shrink the turbinates, shrink the lining of the nose, and your symptoms of nasal congestion have improved. The second group of patients are patients where the predominant symptom is a runny nose. And what we do is we do this once again in office. We put a probe into your nose and we freeze the nerve in the back of your nose. And this causes your nose to produce less secretions and hence fix the runny nose. The third group of patients are patients with eustachian tube dysfunction. And once again, under local anesthesia, we can put a balloon into your eustachian tube, which is the tube between your nose and your ears, and inflate the balloon, relieving your symptoms. And finally, there are a group of patients who have all of the above symptoms, and allergy is really causing them to be distressed. And in this group of patients, I would start you typically on a sublingual immunotherapy tablet, which is a tablet you put under your tongue on a daily basis, and it microdoses you to your allergen. And over a period of about 3 years, you then become cured of allergy to that specific allergen. So the ideal candidate for in-office based procedures are patients who have a specific problem that I can deal with a specific procedure. Of course, you have to be willing to have it done in the comfort of a procedure room or in the comfort of an outpatient clinic setting. And you should know that this does not include general anesthesia, which is a good thing. Of course, we've discussed the other benefits of in-office procedures earlier. Now, touching on specific procedures and who are the best candidates for these procedures. With regards to balloon sinuplasty, which is putting a balloon in the maxillary or the frontal sinus and opening up the sinus drainage pathways, this works really well for patients with either mild sinus disease, recurrent acute sinusitis, or when you have pressure in your sinuses as a result of pressure changes or barotrauma. So we call this baro-induced symptoms. With regards to eustachian tube balloon dilation, this works really well for patients who have symptoms of a blocked ear, blocked eustachian tubes, crackling of the ears, popping of the ears, and also patients who once again have barotrauma-induced symptoms. And typically I see this in cabin crew, in pilots, and in divers, both scuba divers and free divers. And it works really well for this group of patients. With regards to posterior nasal nerve cryotherapy, which is done to freeze the nerve at the back of the nose as a cause of a runny nose, the best group of patients for this are patients who have either allergic rhinitis or non-allergic rhinitis with a really runny, watery nasal discharge. With regards to terminate reduction, the best group of patients for this, once again, are patients with either allergic or non-allergic rhinitis, where the lining of your nose, known as the turbinates, are really swollen. And when I see you in the clinic, I'll be able to assess you and tell you if your turbinates are swollen. The procedure of turbinate reduction under local anesthetic works really well. And finally, if you've ever noticed when somebody breathes and the outside of their nose sinks in when they breathe, so the side of their nose sinks in, this is called nasal valve collapse. And once again, under local anesthesia, I can put an implant into the nasal valve area, which will prevent it from collapsing. And that works really well for a condition known as dynamic nasal valve collapse. The key risks of any procedure or any operation are pain, infection, and bleeding. Specific to in-office procedures done under local anesthesia, the risks are actually less than if you were to have a bigger operation done under general anesthesia. So I would say that discomfort would be a risk, but this can be mitigated by your surgeon by using more local anesthesia. I also specifically use much smaller instruments and much smaller cameras in your nose so that you feel it less. I think with the balloons, the other main risk is that your surgeon or I may not be able to get the balloon into the right place. And so rather than it being a risk of causing harm, it's a risk of failure of the procedure or unable to perform the procedure. With regards to the freezing of the nerve at the back of the nose, the most common risk is a headache, almost like brain freeze, and that is treated with painkillers as well as warm drinks. So the risks are quite minimal, and I would say that after doing several hundred procedures under local anesthesia, I have never had a significant adverse event or a significant complication, and I've never had to abandon a procedure due to either patient discomfort or due to bleeding during the procedure.